Good afternoon and welcome to our Psyches trainer training hosted by the Office of Today's Train the Trainer webinar is designed for the Psyches application at your own organization. You'll want to get to know Psyches, become a super user, and then be able to train other people on how to use it. After today's webinar, you will be able to identify key components in planning for training, implement pre-training activities, describe key information about Psyches and its core competencies for your colleagues who are beginning to use Psyches, and find available training resources to use in your own organization's training. Please note that today's session will not thoroughly cover the Psyches application itself. If you would like to learn more about the application, we recommend watching other webinars available on the Public Psyches website, such as Introduction to Psyches. So, with that being said, let's dive into how you can plan for Psyches training. So, an important piece of planning your training is understanding the workflow of your organization and the use cases for each staff member. What is the protocol expected from your staff members with regard to Psyches use? If you know that ahead of time, it will help inform your training and ensure your colleagues will be able to apply the information you share quickly. So, when you're beginning to schedule and conduct your organization's training, you'll want to consider the following questions. First, who needs Psyches training? Which staff members will need access to Psyches and why? Is anyone already familiar with the application or is everyone starting from scratch? Next, what aspects do they need training on? You've identified the staff who need access to Psyches, but what is each individual's use case? There are a lot of different functionality types within Psyches depending on each staff member's role and responsibilities. Then, what type of training is most appropriate for each staff member? That is, what is the format of your training? For example, are you going to do live demos with large groups? Or are you going to do more in-depth one-on-one trainings? So here we have a table that shows a few examples of roles that might include using Psyches, their Psyches use case, and the domains of training that you may want to focus on to set them up for success. I do want to note that these are just some examples. Based on how your organization is structured, you might consider creating your own table of roles, use cases, and domains to reflect how you and your colleagues will actually use Psyches. So this first row is for front desk staff. Their use case might be attesting to Psyches consent and printing out or saving the Psyches clinical summary to include in clients' records. So their training domains might be the registrar tab and recipient search, since they need to be able to navigate those two features to perform their work effectively. Next, we have clinicians. They might be attesting to Psyche's consent and reviewing the clinical summary as part of their clinical decision-making. So to support that, you might want to focus on navigating recipient search and understanding the clinical summary. Next up, we have supervisors. Their use case might include identifying at-risk clients, supervising clinicians, and monitoring Psyche's use by staff members. So the appropriate training domains for them would be MyQI reports, recipient search, the clinical summary, and usage reports. Finally, we have our quality assurance and quality improvement staff. They might be using Psyches to review performance on quality measures and integrating the clinical summary into utilization and incident review. So you might want to focus on MyQI reports for them as well, along with recipient search and the clinical summary. So you might notice that each of these roles' use cases include recipient search, so that might be a good example of a domain that you may want to spend some time on in each training, just to make sure that everyone is on the same page about how it works and how to use it most effectively in their use case. So now that we've talked about the training needs of your staff members, let's look at some formats you can use to effectively convey that training. So this table includes each training format, who it might be best for, its advantages, and its challenges. So again, these are just some examples, and you might find that there are formats not listed here that work well for you and your organization specifically. So first, we have webinars. Webinars are best for staff who have access to their own computers or an appropriate workspace, as well as people who are self-directed learners, so people who are motivated and willing to explore training on their own. So the advantages of webinars is that they are offered regularly by Psyche staff, so you aren't responsible for developing and facilitating them yourself. They're also available in live and recorded formats, so you can check them out when you have the time. The challenges of webinars, though, is that they are not specific to users' workflows or use cases. So they're intended to inform the entire population of Psyches users or large subgroups of Psyches users. So they tend to be rather generalized. And then another challenge of webinars is that there's no on-site support involved. You are more than welcome to ask a question during a webinar in the webinar chat or ask the Psyches help desk afterwards via email. But that might be a longer process than simply showing a trainer on site what you're encountering and receiving instantaneous feedback. So now we'll get into group training a bit with these next two rows. First up, we have demos. Demos are best for larger groups and individuals with similar use cases. And they're also best for users who are already fairly comfortable with computers and technology, so they can understand and follow what you're doing as they watch. So the advantages of demos is that you can easily tailor them to your specific workflow. But the challenges is that you will need to assess their users' capacity to apply your training. You'll need to make sure that they can apply what they've seen as quickly as possible on the job, and you might find that your staff members will need additional resources or support afterwards as they do that. And then our other challenge for demos is scheduling. Depending on how busy you and your colleagues are, it might be tough to find a time frame in which as many people as possible can attend the demo. So next up, we have hands-on group training. This is also good for large groups and similar use cases. Again, one advantage here is that you can tailor it to your specific workflow, but this format also allows you to provide that immediate feedback and assistance to users as they learn and walk through Psyches themselves. Um, the flip side of this is you have trouble ensuring adequate computer access, since that hands-on training would require everyone to have their own device. Another challenge here is engaging users with different skills. You may find it helpful to assess in advance each person's familiarity with Psyches, just to make sure you're not alienating anyone who's completely new to the application or repeating information that more experienced staff members already know of. A group with mixed experience levels might be really challenging, and you might need to consider strategies to engage as many people as possible. And then again, scheduling may be an issue. And then finally, we have one-on-one training. This is best for staff who need more support with computers or have unique use cases. The advantages of one-on-one training is that scheduling is much more flexible because it's only dependent on the calendars of two people rather than several. And you can also you can also provide immediate feedback and assistance in this case as well. You might even find that the person you're working with feels more comfortable asking questions or discussing issues in a one-on-one environment. But the downside of that is that uh, producing a training like this may require more time and effort, especially if you're conducting multiple one-on-one sessions. You'll need to prepare specific training elements and potentially different resources for people with different use cases in Psyches, and people who are more or less familiar with the application itself, or even navigating similar applications. So you might find that a little bit challenging depending on how much capacity you have as a trainer. All right, so you've identified the people that you want to train, what their use cases are going to be, and what your training format is going to be. Next, you're going to want to prepare for the training session itself. So to prepare your training session, we do recommend starting with an outline. This could include policies and procedures for how to use Psyches, and we have examples that you can follow and adapt to fit your organization. For example, maybe your policy will be that your agency will check Psyches for every Medicaid client you see. Another helpful tool is our core competencies checklist. And that's just a list of questions and answers that allows you to check your understanding of Psyches as you go. As part of the training outline, you'll also want to decide whether you want to use de-identified data for any demos you do. After you've logged into Psyches, you'll see that there is a toggle for de-identified, which will scramble any client identifying information like name, Medicaid ID, date of birth, or address. You'll still be looking at real information, so your staff members will still get a sense of what the application looks like and what you might be able to find in it. But you are protecting those real-life clients' information by scrambling those identifiers. So after you've developed your outline, you'll want to practice the skills you'll be teaching. If you're brand new to Psyches, again, we recommend that you consider viewing or attending some of our other webinars like Introduction to Psyches, using the Psyches Clinical Summary, and navigating the Psyches recipient search for population health, at least to start. It would also be extremely helpful to make sure that users have activated their tokens and tested their login information prior to your training session. And that will just help the session go as smoothly as possible, especially if you're making sure that clients are going, or excuse me, staff that are going into psyches after the session to apply the things you've trained them on. And then finally, you'll want to have training materials and contact information on hand so you make sure so you're able to have tools and resources to reference after the training. And you can also use those training materials to answer any more specific questions individuals might have. So our public PSYCKES website, psyches.org, includes an Implementing PSYCKES page. This page just has a brief overview of the steps you'll take during PSYCKES implementation, as well as several tools that might be helpful to you during that process. So for example, we have an implementation planning tool, we have policies and procedures, and we have the core competencies checklist that we mentioned before. So let's take a closer look at our core competencies checklist. This left-hand column shows user skills, such as logging into PSYCKES, searching for clients, and accessing clinical summaries. And the right-hand column is a sort of answer key, and that just shows the processes that users need to follow to perform each skill. And again, this is broken down by different use cases. So all users will need to know how to log into PSYCKES, but a clinician in particular might want to be able to review the integrated view of services over time graph, for example. You might want to use this checklist as an outline to follow during training, just to ensure that everyone can meet these core competencies. So another page we have on the PSYCKES website is our PSYCKES training materials page. We have short how-to videos that go over the different aspects of logging in, looking up clients, and reviewing the clinical summary. We also have a set of user guides that go over different features in the application. So like we have one on the mobile application, enabling access to client data, statewide reports, provider search, etc. So those might be helpful in answering more specific questions you might encounter. Okay, so now that we've covered ways you can structure your PSYCKES training, let's give you a brief rundown of the data that's actually available in PSYCKES. So PSYCKES is a secure and HIPAA-compliant web-based application that integrates multiple data sources, mainly Medicaid and state administrative databases, to support population health, quality improvement, care coordination, and clinical decision-making. It includes 5 years of data and beyond for certain data elements like clients' suicide attempts for the Medicaid behavioral health population. So PSYCKES includes all Medicaid fee-for-service claims and managed care encounters across service settings. It also includes information about medications, medical and behavioral health, outpatient and inpatient services, emergency services, crisis services, care coordination, and more. So data for individual clients is all incorporated into their clinical summary, which is updated weekly. PSYCKES also includes 80 plus quality flags related to clinical concerns. So clinical summaries also include these quality flags where applicable, and you can also identify cohorts of recipients that meet criteria for those flags. So for example, we have quality flags related to low medication adherence, high utilization of inpatient and ER services, and eligibility for Health Home Plus services. And those are updated monthly. So in terms of training, it is important to teach your users what information they can access in PSYCKES. Um, yeah. So another thing to talk about when teaching new users about PSYCKES is that there are certain limitations regarding our data. So the first thing is that accuracy depends on coding and billing. So if there's an error entered in on a bill, then that error will be reflected in PSYCKES until it's rectified. Another point you'll want to make is that data elements are what is shown on Medicaid claims. So for example, if you see in PSYCKES that a certain lab was done, you can see the name of the test, or the date, the name of the test, and the provider. But you can't see the actual test results because that data isn't included in the billing data. There's also a lag between the time a service happens and when it shows up in PSYCKES. That lag can vary in length. It really depends on how quickly a provider bills, how quickly a managed care company gets their information to the Department of Health, and how quickly the data is received from the Department of Health. And this is usually every week. Lastly, client data might be affected by hospitalizations if those were bundled services, if the client has recently lost or obtained Medicaid coverage, or if they've recently moved. So the takeaway message here is that the data in psyches can provide a lot of important information about a client's treatment history, but it might not be the full clinical picture. Another example of this is that we don't currently have Medicare data. So if a client is dual eligible and has both Medicaid and Medicare, you will only be able to see their Medicaid information in psyches. We do have alerts for clients who are dual eligible or who have recently enrolled in Medicaid, just to make sure that anyone accessing their clinical summary knows that there might be limited data available, but it's still an important thing to keep in mind. When training your staff, it's also helpful to think about appropriate ways to handle any inconsistencies between what a client self-reports and what is listed in psyches. And the goal in that really should be to support the dialogue between the clinician and the client rather than just relying on what's listed in psyches. Another thing to consider when you're training is that there are different levels of access in which you can see client level data. So this chart we have here is a comparison between the different types of access, whether that type includes data with special protections, and the duration which it's available. So just to review this briefly, if a client has been billed for a service by your agency to Medicaid in the past 9 months, you won't be able to see their data. And it's the same thing if you attest that a client is being served at or being transferred to your agency. They will just be linked to your agency for the purposes of recipient search results, recipient search reports. So this third row is for clinical emergencies. And clinical emergency access grants access to all data, including data of special protections, but that expires after 72 hours. After that, you will need to obtain consent in order to continue viewing a client's data. And then you can obtain a signed psyches consent form or BHCC consent form, which will allow you to access all data for up to 3 years from the last date of service bill to Medicaid. This means if you continue to bill them, the consent will continue to renew. DOH Health Home consent is similar, but you can only see the client's data as long as their enrollment is verified in DOH MAP, and that does have a 90-day grace period. I do want to highlight that if you're a state level or a managed care user, this chart doesn't apply to you. These user types are able to see all available data without consent because they have a different agreement for data sharing. So the training takeaway message here is that data with special protections is only available with consent or if there's a clinical emergency. It is important that staff make an effort to obtain a client's signed consent rather than just using the clinical emergency option. It just shows respect for clients and their autonomy, and it also gives you access to their data for a longer period of time so you can provide more informed care for longer. For any managed care users, remember that you don't need consent to see this information. You will be able to see data for both and enrollees. And we do have some protocols listed here for clinical emergencies for reference. So if a patient refuses or is unable to consent and is having a clinical emergency, you can obtain a clinical summary without consent. And you might think of this as breaking the glass in an emergency situation. So more formally, a clinical emergency is defined as a medical or behavioral condition for which there's an immediate need for treatment. The symptoms the client is experiencing are of sufficient severity that the absence of immediate treatment would likely result in serious harm to themselves or others. And if you're a provider, you're responsible for ensuring that the medical record supports emergency access by documenting why and how the client meets criteria for clinical emergency. And you need to attest with your signature, date, and timestamp. All right, now that we've covered our psyches data, let's discuss our core competencies a little bit. So we do have a short list of core competencies that we'll cover in our session, and those are logging into psyches, finding clients through both the individual search and cohort search features, navigating the clinical summary, changing the PHI access level for a client, and identifying clients with quality flags. And we do just have some considerations here before you log into psyches. So each user must be given psyches access in the OMH Authorization Management System, or AMS, by your organization security manager. That may be you or that may be another person at this agency. But we highly recommend making sure you know who your security manager is and just make sure that each user has been in contact with them. Once the user is added in AMS, they will receive an email with their user ID and instructions an ny.gov password. And that password is required to log into the self-service console where you can request a security token. That security token is required to log into PSYCKES. Depending on your organization and whether you can access your phone while you're working, you can request a hard token or a soft token. A hard token is a physical keychain that will show you different passcodes, and a soft token is the RSA Authenticator mobile app. And you'll activate and install that app once your request for a token is approved by OMH Security. Once you have your token, you'll need to set a PIN through the self-service console. There are quite a few guidelines for what your PIN can be that we have listed here. So your PIN must be 8 digits long. It cannot begin with 0. It cannot have consecutive or sequential numbers. And if you already have created a PIN in the past, you cannot use one of your 5 most recent PINs. Okay, so with that being said, we have our first core competency, which is logging into PSYCKES. When you're teaching people how to log in, it's ideal that you direct them to our PSYCKES homepage at psyches.org and have them select this blue Login to PSYCKES button. If you're going to encourage staff to save or bookmark PSYCKES in their browser, again, we recommend that you actually save this homepage rather than the actual login page. We have had people reach out with technical issues resulting from bookmarking that login page, so this will just help prevent those issues. So here we have the page that will come up when you select Login to PSYCKES. If you're not an OMH employee, you're going to select this external local provider option on the right. So you'll enter your OMH issued user ID that you use to log into the self-service console. And then it's going to ask you for your passcode, and that is where your PIN comes into play. If you have a soft token, you're going to enter the PIN into your RSA token app on your phone, and it will generate an 8-digit code. You'll enter that code in the passcode field. Just to note, you do not enter your PIN on this screen if you have a soft token. If you do that, it won't let you in, and you'll probably get an authentication failed message. So this is for hard tokens now. If you have a hard token, and you'll also enter your OMH issued user ID here, and then the first time you log into PSYCKES, you will enter the 6 digits displayed on your physical hard token. After you've entered the code from your hard token, you will be prompted to create an 8-digit PIN. So you'll just enter that into this new PIN field here and select sign in. Then once you've done that, you'll return to this login screen that you saw before. Once again, you'll enter your user ID, and then you'll need to wait for the code on your hard token to change. After that, you're going to enter your PIN that you just created, followed by your new token code in the passcode field. And I do want to emphasize, because this can get a little bit confusing, that this process is just for hard tokens. If you're a hard token user, you will be entering your PIN and your passcode in this field. If you're a soft token user, you will only be entering the 8 digits that are generated in your RSA token app. Okay, so now that we've covered that, we just have a list of common issues with logging into PSYCKES here. You will want to be prepared to encounter token issues during or after your trainings, because like I said before, it can be pretty confusing. So you may hear people say that my token doesn't work, I see an authentication failed message, or I see a wait for the passcode to change message. And most of these errors are just based on issues entering the passcode or your PIN into either that sign-in screen or the RSA app. So if you come across an issue like this and you are a non-OMH employee, you'll want to contact the OMH Help Desk at 518-474-5554 and select option 2, or email healthhelp@its.ny.gov. If you are an OMH or State Psychiatric Center employee, you'll want to contact the New York State Help Desk. Once you've successfully logged into PSYCKES, we have our next core competency, which is finding clients. So you will probably land on the screen we have here once you get into PSYCKES. And in the navigation bar here at the top, you're just going to select recipient search. And this is the page that will show when you select recipient search. So we have our 2 tabs. We have individual search and cohort search. An individual search is the default. So here you can search for individuals by their Medicaid ID, their social security number, or their first name, last name, and or date of birth. So you actually only need their last name or their first name or date of birth. If you have all of those, it's great. It's helpful to be as specific as you can. But strictly speaking, you only need their last name or first name or date of birth. Um, if you're searching by name, you do have the option to enter different characteristics down here, like their age, gender, race, ethnicity, region, or county, just to narrow down those results a bit, because some individuals may share a name with others, and being as specific as possible reduces the possibility of a PHI breach. So next we have the cohort search tab, and this feature lets you search for cohorts of interest to your organization. So that might be based on age and gender, HARP status, AOT status, their managed care plan, the quality flags they meet, the prescriber, the services clients have received, the diagnoses these clients may have received, the medications they're taking, and more. Okay, so let's say you just searched by a specific agency. So this brings up anyone who has received services from your agency. On this results screen, you'll be able to see client names, genders, and ages, Medicaid IDs, dates of birth, race and ethnicity, managed care plan if they have one, Medicaid quality flags they meet criteria for, planning considerations, and the current PHI access level. So if you already have PSYCKES consent for an individual, you will be able to select their name in this name, gender, and age tab. So in this example, you can see that some of them are just plain black text and others are selectable links in blue. And if you select that link, it will take you to the client's clinical summary. Okay, so we have another list of common issues here for your reference. So one thing you might come across is somebody learning how to use PSYCKES saying that they searched for a client in recipient search, but it did not yield any results. And there are a number of things that could be causing this. They might have made an error entering the client's Medicaid ID or other identifiers. The client might not yet be linked to your agency through billing or through the PHI access module. The client might be new to Medicaid and might not have had a behavioral health service diagnosis or medication going Medicaid. And for managed care users only, the client might not be enrolled in the plan anymore. So to find them, you can try selecting current and recently disenrolled in the managed care enrollment filter in cohort search. All right, so our next core competency is the clinical summary. So this is what the full summary view of the clinical summary will look like. You'll have the client's general information at the top. You can see the current care coordination section in the middle there, and then you have notifications. Whoops, sorry. And then you'll be able to see notifications underneath that. I do want to highlight here that up in this right-hand corner, you do have the option to show or hide data with special protections. So in this example, we have show all available data selected. So this clinical summary would show data with special protections, but you can also choose to hide that. And just to define data with special protections quickly, that category includes any information related to substance use, HIV, family planning, or genetic testing. You will only be able to see that specially protected data if you have signed consent or if the client is having a clinical emergency. So up in this left-hand corner, you can navigate to different sections of the clinical summary. You just have this hamburger menu here. So the different sections of the clinical summary we have in this example are care coordination, medication, controlled substances, behavioral health medication, medical medication, behavioral health outpatient services, medical outpatient services, crisis services, hospital and ER services, dental, vision, living support and residential, lab and pathology, lab results from state PC EMRs, radiology, medical equipment, and transportation. Some of these may not be available in every client's clinical summary, like the laboratory results, because that's specifically coming from the state psychiatric center EMR. So some sections you may see appear towards the top of the clinical summary are active Medicaid restrictions, alerts, and social determinants of health reported in billing. So active Medicaid restrictions is not an especially common section, but it will show the specific provider that a client might be required to see. So for this example, the client is restricted to seeing one nurse practitioner. Next up, we have the alert section. And in this example, we have homelessness alerts for DHS shelter, homelessness alerts for DHS outreach, and a treatment for suicidal ideation alert, as well as a homelessness reported and billing alert. So those are just a few examples of some alerts you might be able to see. Some other examples might be a recent opioid overdose, a recent suicide attempt, OMH unsuccessful discharge, things like that. Then down here we have our social determinants of health. These have to be reported in Medicaid billing through Z codes. So if a client is new to Medicaid or has not had a bill with a Z code, you may not be able to see their social determinants of health in their clinical summary. So here in this example, we have other specified problems related to their primary support group, homelessness unspecified, housing instability housed unspecified, unsheltered homelessness, insufficient health insurance coverage, and other specified lack of adequate food. Okay, so now we have our quality flags. So in addition to this table form showing, you can also view a client's quality flags in graph form. So here in this example, we can see that the client meets criteria for overview for breast cancer screening. Then we have some substance use disorder performance tracking measures. So we can see that the client meets criteria for no engagement in opioid use disorder treatment, no engagement in substance use disorder treatment, no initiation of opioid use disorder treatment, and no initiation of substance use disorder treatment. Underneath our quality flags, we have our plans and documents. So this section just lists the plans and documents that the user or their provider may have uploaded. And some plans and documents might include a safety plan, a care plan, a relapse prevention plan, a psychiatric advance directive, and other documents like that. So here we can see that the client has a safety plan uploaded. So if you have appropriate consent, you will be able to see plans and documents that other providers have uploaded. Next up, we have screenings and assessments. So the main ones we have here, or we have in PSYCKES, are the CSSRS for suicide risk and the PHQ-9 for depression. So this section will just show the name of the assessment, the number of times it was entered, the last assessment date, the last provider who administered the assessment, so we can see here that this person was administered the assessment via the PSYCKES mobile app, so you'll be able to see if that's the case for any other clients you're looking at, and you'll be able to see assessment results as well. So we can see that this person received a score of 0 out of 27. They're not demonstrating any features of depression when this assessment was administered. All right, so now let's look at the behavioral health and medical diagnoses sections. So these just list the diagnoses that a client may have received, and we have the most frequent ones listed first. So we can see under behavioral health diagnoses that this client has been diagnosed with other stimulant-related disorders frequently. And I do want to mention that the highlighted ones here are diagnoses that would be considered data with special protections because they're all related to substance use. So if you had toggled off data with special protection, or if you did not have access to data with special protection, you would not be able to see these. Then down here, we have medical diagnoses with the same format. So we can see that this person has several diagnoses on record. And again, the HIV diagnosis highlighted at the top here would not be visible if you did not have access to data with special protections. And you can select any of these diagnoses to drill into the services that a client has received that are associated with these diagnoses. So in many sections of the clinical summary, each section can be viewed as either a table or a graph. It will show a table by default. And you can select this details option next to the title of the section, and that will give you more information for all services within that section. Then if you select this little box icon here on the right next to each entry in the table, it will give you more information about that particular episode of care or that particular medication. And here we just have an example of our integrated view of services over time graph. So this just displays all services that the client has received over time in graph form. And that's just meant to make it easier to identify utilization patterns like medication adherence and use of outpatient, inpatient, and ER services. So we can see here that this client has been enrolled in different health homes and outreach they've received, whether they've been on medication, the different kinds of clinical services they've received, and things like that. So this can be particularly helpful if you're looking to identify overlap or trying to determine how long a client has gone without a specific service. And here we just have another sample section. So this is the medication for behavioral health section. So you'll be able to see the drug class all the way to the left, the name of the drug, the last dose they were prescribed, the estimated duration of the medication, the first day they picked it up, and the last day they picked it up. And again, you can view more details by selecting the details link next to the title of the section or the boxes on the far right of each table entry. And here we just have an example of that drill in with amphetamine, dextroamphetamine. So here you can see we have two tabs. We have orders and trials. So the orders page will just show you the pickup date, the brand name, the generic name, the drug class, the drug strength, the quantity dispensed, the number of days supply, the number of tabs taken per day, the total daily dose, the route, the prescriber, and the pharmacy. I do want to note that you can export this to either PDF or Excel if you'd like, just to make it easier to navigate and sort of filter through. And here we have the graph view of the behavioral health medication section. So we can see that the client has been on several medications for varying lengths of time. I do want to highlight again that this graph does start 5 years beforehand. So we can see that in July 2021, they were not on any medications. And then we start getting more data right around April of 2022. Next up, we have our crisis services section. So this section includes service type, provider admission, or date of service, discharge date or date of service, the number of visits or the length of the stay, the most recent primary diagnosis, and the most recent procedures the client has had. Again, you can select this details button next to the crisis services title to view more details, or you can drill into a specific service by selecting the details boxes on the right. We also have ER services, and that's roughly the same layout as the crisis services. So we have our service type, we have our provider, we have our admission date, we have our discharge date or the last date billed, we have the length of the stay, we have the most recent primary diagnosis, and we have the procedures per visit. So this section is going to include hospital and ER visits for substance use, medical purposes, mental health purposes, and behavioral health purposes. Towards the bottom of this clinical summary, we do have a variety of different sections. So here, for example, we have dental, vision, and living support / residential treatment. So vision and dental basically have the same layout. We have service type, provider, first date billed, last date billed, number of visits, and most recent procedures. And then down here we have living support and residential treatment. And that section has programmer type, provider name, first date of service, last date billed, number of visits. And then for all of these, again, we have that details icon you can click on to view more information about each entry. All right, so we have laboratory pathology now. Again, Medicaid billing does not include results of lab or pathology tests so that's not going to be included here. But in this section, you can at least view the kinds of tests or panels the client has had, the first date it was billed, the last date it was billed, the number of tests they received, and the most recent lab or pathology provider. Okay, and just to note, you can export the data in the clinical summary to PDF or Excel if you'd like. So this is the PDF example. Here you can choose to include the brief overview as a sort of cover page, and then you have different export options. You can export all sections and just include the summary data. You can export selected sections here in this little menu down here, and again, just include summary data, or you can export your selected sections for all available data. You can also choose to flip the page between portrait and landscape view, and you can also choose to again, include or exclude certain sections. And if you're a brief overview view of the clinical summary, you will only see the PDF option. If you're on the full summary page, you can export to either PDF or Excel. Okay, that was a quite a bit of information because the clinical summary can get quite long, just depending on how many services the client has had that are billed to Medicaid. So we have a few common questions here on what the clinical summary looks like and how it might look. So for our first example here, we have someone saying that they can't access a client's clinical summary even though they could recently. So a couple of possible explanations for that are that the client had emergency access enabled, but expired after 72 hours. And again, if you're a managed care user, the client may have disenrolled from the plan and sort of fallen out of the recently disenrolled group of clients. Then again, we have why can't I see lab results? And those are not included in claims or encounter records, so PSYCKES does not incorporate them unless they're from a state PC because there is data sharing between PSYCKES and EMRs from state PCs. And then finally, why does it say no Medicaid claims available for this data type? So a lot of clients might not have received that kind of service. So like maybe for dental or vision, sometimes people just don't have claims there at all. But also the bill may not have been processed yet. Like we mentioned before, there is typically a lag between when a service is received and when it's included in PSYCKES. So it all really depends on how quickly the bill just gets processed. Okay, let's move on to another core competency. This one is changing PHI access and recipient search. So we're going to return to our individual search page, and we'll just do Medicaid ID. Um, and you'll see we have one recipient found for this Medicaid ID. So we can see this person's name is John Doe. He's male, 30 years old, has a birth date of June 1st, 1996. His Medicaid ID. We would be able to see his race and ethnicity, but it doesn't look like it's known. We have address, managed care plan. Not that there is one. We can see that he meets criteria for the no outpatient medical services quality flag. We can see that they have planning considerations, so complex needs and mental health placement consideration. And finally, we can see that the current PHI access column shows that we have not yet enabled access for this individual. So you'll always want to make sure that the client that comes up that you're enabling access for matches the client that's actually showing up in your recipient search just for security purposes. So let's say we've just double checked this is the client we're looking for. So we're just going to go ahead and select this enable access link. And again, I do want to emphasize that if you have PSYCKES access, you are partially responsible for gatekeeping the PHI of over 13 million individuals. And that includes that information with special protections. So it's really important to make sure that you are making your treatment decisions based on the correct client information and not, just releasing information of someone who has not consented. Okay, so once we've selected Enable Access, it will bring up this PHI Access module where you can select the appropriate level of access. And you might have slightly different options based on what kind of facility you're coming from. But here in this example, we have client signed a PSYCKES consent, client signed a BHCC patient information sharing consent, and client signed a DOH Health Home patient information sharing consent for signed consent options. We also have client gave verbal PSYCKES consent, and this is a clinical emergency. And then finally, we have client is currently served by or being transferred to my agency. And again, that will link the client to your agency, but it will not in itself provide access to their clinical summary. And if you're not sure what one of these options means, or if you or one of your staff members would like to learn more about what each access level entails, you can just select this About Access Levels link available at the top right side of the screen. And just to drill in a little bit more on those different levels of access, just for reference, having a signed consent of one of these three types will allow you access to all available data, including data with special protections, for 3 years after their last billed service. If the client has given you verbal consent but has not signed a consent form, that will allow you access to limited data for 9 months. So that excludes data with special protections. If it's a clinical emergency, you will be able to get access to all available data, including specially protected data for 72 hours. And then finally, we have attestation of service, which is where the client is currently being served by or transferred to your agency. And again, that will link the client to your agency for recipient search reports, but will not provide you access to their clinical summary. And this is just what the Psyche's physical consent form looks like. So you will fill in the name of your provider or facility, the name of the patient's date of birth, the Medicaid ID number, and then the client will choose to give consent or not give consent. They do need to check off their consent choice, otherwise this consent form is invalid. And then they or their legal representative will just have to sign and date it. Um, and you can pre-populate this form with your facility information through the registrar tab in PSYCKES. And you can find more information about that on the PSYCKES website, but for the purposes of this session, just know that the client needs to check this off and sign it in order for. And again, just a quick aside about filling out these consent forms. If you're not using that pre-filled registrar version, you can also save the PDF from our public PSYCKES website. Um, you can type your facility name at the top of the first page, and then it will pre-populate each field where you need to enter the facility name. And that just leaves you 2 sections to fill in manually if needed. So Section 5 covers improper access or use of client information. So in these first 2 blanks in Section 5, you should enter the name and phone number of the individual at your agency who handles potential incidents of improper data access. So that might be an administrative assistant, a clinician, your security manager, or another patient relations role. You will just want to make sure that this person can log into PSYCKES and knows how to consent and audit staff usage. Then Section 8 covers withdrawing consent. In the first and second blanks, you'll want to enter the name or title of the individual to whom the client can submit their PSYCKES consent withdrawal form, which is again available on the PSYCKES website. In this third blank, you'll enter their phone number. This doesn't necessarily have to be the same person listed in Section 5, depending on your facility, but they should have the same ability to use PSYCKES and be able to withdraw client consent. Okay, so returning to our PHI access process here, the next step is to verify the client's identity and submit. So you're going to have to confirm that this is the correct individual. It shows the individual's unique identifiers, date of birth, and address here. And then you'll just have to select the option explaining how you know this is the correct person. So you can either attest to the client's identity yourself, or you can enter that the client provided either one photo ID or 2 forms of non-photo ID. So once you've done that, you can select previous to go to the previous step of the module. You can select cancel, you can select enable, or you can select enable and view clinical summary. So immediately upon entering this consent, any PSYCKES user at your agency will be able to view the client's data. All right, we just have some common questions here about changing the PHI access level. So first off, let's just quickly review what's considered a clinical emergency. So that is a medical or behavioral condition for which there's immediate need for treatment, and the absence of immediate treatment would likely result in serious harm to the individual or to others around them. Some examples we have here, just so you can judge this a little bit more effectively, is threats or attempts at suicide or serious bodily harm, homicidal or other violent behavior causing reasonable fear of serious physical harm, inability or refusal to provide for essential needs due to mental illness, and overdose, sedation, altered mental status, or catatonia. Um, so our next question here is, when can I attest that I know the client's identity? So oftentimes this is if you've met with the client before and you're confident that they are the same person you've met with previously, you can attest to that. But we really recommend that you develop internal processes for this just for documentation purposes. So we recommend that you document your rationale for knowing the client's identity, that you keep a copy of their ID and their chart, and you also want to make sure that you're comfortable making clinical decisions based on the information they've provided. Okay, and we have our last core competency here, which is identify with quality flags. So this is our quality improvement page on the My QI report page. You can see there's 2 tabs here. We have the quality improvement tab that's selected, and we have our performance tracking tab. So you're going to go ahead and select the indicator set you want to look into more from the list on this page. And you can find out more information about these indicator sets on the PSYCKES website. But for the purposes of this, we're just going to go ahead and choose high utilization, inpatient, and ER. And then you're just going to drill down on your selected indicators. So you'll see that the indicator set includes all of these different indicators, and then you're just going to select the specific one that you'd like to explore. So let's say we're going to go with 2 or more ER visits for mental health. And then this will allow you to drill in more. And then to view clients who meet criteria, you're just going to select the recipients tab here. And that's going to show you the list of individuals that meet criteria for that flag. And again, you can either export this list to PDF or Excel, or you can select their name if you have consent to view their clinical summary. So again, that was a lot of information, but we hope it helped you understand PSYCKES and the features within it at a high level. If you need more information or if you have questions, we do have some training and technical support resources for you. So I did mention these before, but I do want to emphasize that we do have a variety of different training materials on the PSYCKES website listed under PSYCKES training materials. So we have those short how-to videos, user guides, and new features release notes. We also have a list of PSYCKES training webinars on the PSYCKES training webinars page, and those are divided into different categories. So we have role-based trainings, featured trainings, accessing PSYCKES, and release overviews trainings. And those just have the recordings and slides listed. If the webinar will be offered live soon, there will be a registration link in this column, along with the date and time. And if you're new to PSYCKES, again, we would highly recommend checking out the Accessing PSYCKES webinars available here, because they'll go more in depth about the process of gaining PSYCKES access and logging in. And as I mentioned before, there is information about indicators or quality flags listed on the PSYCKES website under quality indicators. So we just have a brief description of what quality indicators are, where they come from, and then we have technical specifications documents for each indicator set. If you have any questions about the PSYCKES application specifically, you can reach out to our help desk at psyches-help@omh.ny.gov. We're available Monday through Friday from 9 a.m. to 5 p.m. And again, this is specifically for the PSYCKES application, meaning the features and data you have access to after you log in. If you're having issues with your security token or logging into PSYCKES, you can contact either the ITS or OMH help desks. If you're an OMH or a state psychiatric center employee, you can contact the ITS help desk. If you're a non-OMH or non-state PC employee, you can contact the OMH help desk. All right, so now I would like to open it up to questions. Michelle, have any questions come in for us?
Hey Cameron, yes, we have two questions. The first question is, can we assign more than one security manager?
Yes, you can, and we actually highly recommend you do that, just to make sure that if one security manager is out, users who need access to PSYCKES can contact the other one and get timely access.
Awesome, thank you. And the last question is, I've noticed that the withdrawal of consent contact information in the consent form is outdated. How do I go about updating who people should give the withdrawal of consent form to in our PSYCKES consent?
So you can go ahead and go to the registrar tab once you've logged into PSYCKES, and you can find there the contact information you have already listed on those forms, and those are editable text boxes. So you can just enter the name, title, and contact information of the individual that people should submit withdrawal of consent forms to, and then you'll just be able to update it from there.
Awesome. Thank you, Cameron. That was all the questions.
Awesome. Thank you so much, Michelle. And thank you all very much for attending our Train the Trainer session today. We appreciate your time and attention, and we hope you have a wonderful rest of your day.